Welcome to the Reproductive Partners Fertility Center webinar on fertility and finances and what to expect and how to prepare to be able to embark on this journey of infertility. We will give a couple of more minutes for anyone else who would like to join this webinar, and then we will proceed. Like we have a couple more that have joined in. That's wonderful. Welcome. We're excited to have you. Give it another minute and then we'll begin. Okay. Well, again, welcome. Thank you for taking time out of your day to be able to join me today on this webinar again on fertility and financing. I am going to host this webinar for you today. I am Shannon Taylor, and I am currently an insurance administrator at Reproductive Partners Fertility Center, San Diego. I have been working with Reproductive Partners for 14 years. I began working with Dr. Garzo and the rest of the team in 2011, and I've been a part of the administrative staff ever since then. I have had the opportunities to be able to bridge the gap between the administrative team and the clinical team and the laboratory team, as well as some of our physicians. And it brings me great personal joy to be able to provide this service to our patients. Infertility is a very personal journey, and I experienced infertility myself, and that gives me a stronger drive and ambition to continue to help advance the experience for our patients here at Reproductive Partners. Today, we are going to have an overview of financial aspects of fertility care. And the financial aspects of fertility care can be significant and ranging from tens of thousands of dollars for procedures like IVF to lower costs for other fertility treatments. And it's crucial for individuals to understand the potential costs, explore insurance coverage options, and consider financial resources like payment plans or loans to be able to manage these expenses. Proper planning helps individuals understand the costs and explore financial options, create a realistic budget, and ultimately make fertility treatment more achievable. It also allows for a more informed decision-making process to be able to look at treatment options and to help eliminate or minimize financial stress. So today we'll go over these three sections: the financial landscape of fertility treatments, understanding fertility insurance coverage, payment options, and for financial assistance. And there will be time at the end for any Q&A that may come up along the lines of this presentation. So first of all, we're going to look at this financial landscape of fertility treatments. And this is necessary during infertility, and we need to be able to look at the rough costs of some of those treatment types, as well as touch base on other factors that can influence the costs on a more individualized level rather than generalized level like potential cost for treatment could be. So we'll take a look at those three ideas as we move through. So this first part, these are common fertility treatments, and treatment for infertility depends mostly on the cause and your overall goals. Your age, how long you've been trying to conceive, and your personal preferences are all factors in deciding on treatment. And sometimes one person needs treatment, but other times treatment involves both partners. And some couples need more help conceiving using assisted reproductive technology, or ART. ART is any fertility treatment that involves a healthcare provider handling the sperm or the egg. And the first one that falls under infertility, as you can see, is intrauterine insemination, or an IUI. This procedure is where a healthcare provider uses a long, thin tube to place the sperm directly into the uterus. It's basic treatment, or a lesser treatment of what you might call it, and can help a small range of patients conceive. The other type of infertility treatment is in vitro fertilization, or IVF. IVF involves retrieving eggs from the ovary, then placing them with sperm in a lab dish. The sperm fertilizes the eggs, and the provider transfers a fertilized egg or an embryo back into the uterus. Now, these services, IUI and IVF, are considered standard infertility treatment services. And when a couple has met the definition of infertility as defined by the American Society of Reproductive Medicine, and they need medical intervention to assist them with conception, these are the fertility treatments that we look into. Now, the other side of treatments that are available have a slight difference in them. Advances in assisted reproductive technology over the years has given a new opportunity on preserving fertility. Fertility preservation before what's called iatrogenic treatment, or treatment that is going to directly or indirectly affect one's fertility after undergoing something like chemotherapy, radiation treatment, or pelvic surgery that can damage your reproductive organs. For women, this would include options like freezing embryos or eggs under iatrogenic treatment fertility preservation. And for men, sperm banking is a common method that's effective. These services are becoming more and more common to be covered by insurance with this fertility preservation. And some of it is under what we know as a state mandate. Like in California, it's the Senate Bill 600. But many forward-thinking employer groups provide fertility preservation options for these patients that they didn't have before. And that can be a benefit that can be on an employer-sponsored plan. However, there has been a cultural shift that has developed a separate branch of fertility preservation. And this is the social fertility preservation, or an elective egg freeze. Now, this elective egg freezing aims to preserve a woman's fertility for later use when she decides to have children, allowing her to delay childbearing and choose to focus on career goals or education or finding a partner before starting a family, and avoid potential age-related fertility decline, making conception more difficult. It does involve retrieving eggs from the ovaries and freezing them and storing them for future use with in vitro fertilization, the same way that you would for standard infertility or for fertility preservation before cancer therapy. But more often than not, this one is an elective procedure. And unless the employer group you're working with elects to add this coverage to their plan, it tends to be an out-of-pocket expense. So let's go ahead and take a look a little bit more closely at our standard infertility treatments and some of the estimated costs that come with them. And so now that we have this foundation of certain fertility treatment options that we have to help have a baby, the biggest question is always, how much is this going to cost? Now, on a generalized approach, here we're going to be kind of scraping the surface of costs associated with two of these infertility treatments. We're going to discuss IUI and IVF. And first, with IUI is a much lower cost option for treatment, but it's not always indicated to be the best treatment protocol depending on the patient's diagnosis. However, for those that can try IUIs, here's a small breakdown of what you could expect with the cost of an IUI. If you're going to have minimal stimulation, generally that means oral medication to induce ovulation induction, it generally costs a lot less. Now, this minimal stimulation can range between $1,900 and $2,500. But this isn't just the procedure itself. This is including costs that would also involve the monitoring appointments like office visits and ultrasounds and blood work that will be necessary during the monitoring portion of a cycle. The other type of IUI treatment that can come into play if necessary is one that's called controlled ovarian stimulation with IUI. This procedure itself is very similar to a minimal stimulation IUI cycle, but this would involve injectable medication for ovulation induction. And so this overall cost, depending on how many appointments that you're going to need for your monitoring, it can range anywhere between $3,800 and $4,500. But again, that includes your office visits and ultrasounds and blood work. And depending on how well you respond to the stimulation medication, it may cost you more to be able to purchase more medication. And as I just said, the cost can vary based on the medication dosage that you have, as well as the number of cycles that you may need to try before it's actually effective and you're able to conceive. The other estimated costs of treatment that we'll discuss here on this other side is in vitro fertilization. Now, this is an average cost. This can range anywhere between $12,000 to $30,000, depending on the needs of the patient and any additional services that are necessary to maximize the outcome. Now, costs can vary based on a couple of things. Costs can vary based on the clinic location. It can differ when you're in by city and where you go. It can be big cities with potentially being more expensive than smaller cities, you know. Medications, as we discussed with the IUI, they can cost the cost can vary based on the type of medication and the amount that's required. Some patients, for example, may only need 9 days of stimulation medication, while others could potentially move up to 12 days of stimulation medication, and that can affect the amount of medication that you're going to need. Another factor that can vary on your costs is if it is necessary to use donor. Using donor eggs or donor sperm can increase the cost significantly, as well as multiple cycles being necessary and being able to look at those. So one of the other small features to focus on too is these additional services that can potentially add to the cost of IVF. This includes this is ICSI is what we call that. If you're not familiar with what that is. This is called an intracytoplasmic sperm injection, which is a procedure done in our embryology lab to be able to take one single sperm, that's the best one, and inject it directly into the egg. It allows for better fertilization and less excess. The other additional service that can be provided to patients is what's called pre-implantation genetic testing, or PGT. And there's 2 different types of genetic testing that can be completed when you're going through IVF cycles, and that has an added cost. Then you also have to consider the subsequent treatment after IVF with the frozen embryo transfer, as well as if there are any remaining embryos that have come from your IVF cycle and the need to store them. And the fees for storage can add into your overall costs. So aside from different procedures and different services that add to these costs, let's talk a little bit more about other factors that can influence your costs. As we said, several factors contribute to the cost of IVF, including the number of cycles required, the location of the clinic, and the type of services utilized. Medication costs, donor materials, and the advanced technologies can also impact the overall expense, as well as if there's any insurance benefit available for treatment that can affect your costs, hopefully in a positive way. A more detailed look at a couple of these factors are the number of IVF cycles that might be required. Many couples need multiple IVF cycles to be able to achieve a successful pregnancy, which increases the overall cost. Another factor to consider is the clinic location. IVF costs can vary significantly by the region, with typically, higher costs in major cities with a higher cost of living versus smaller cities with a lower cost of living. But then something else that you need to consider are non-medical expenses, like traveling to the clinics and taking time off of work. That can also add to an overall cost of being able to get your infertility treatment that you'll want to make sure that you plan ahead for. Another thing, as he said, is the type of IVF. the different type of protocol that your physician finds to be the most beneficial for your diagnosis will affect your costs. It can help with the medications. And as we understand it, fertility medications can range from $4,000 to $8,000 or more per cycle, depending on the medications prescribed and the treatment duration. If your IVF cycle, as we said, involves donor materials like donor eggs or donor sperm or even a donor embryo, those add to the costs with potentially different prices for a fresh donor versus a donor egg bank purchase, for example. And as I said on the previous slide, additional procedures like ICSI and pre-implantation genetic testing can enhance your success rates, but they do come with extra fees to be able to complete that. And as we wrap things up on this influencing factors, insurance coverage for IVF does vary, and some states have mandates that are requiring coverage for certain fertility treatments. But even with insurance, there will be limitations in coverage, such as you'll be responsible for copays, you're still responsible to meet your deductible and your out-of-pocket maximum, and there may be services that are deemed not medically necessary, and you're unable to bill them to your insurance. And so that adds an additional cost out of pocket that you may not be ready for. Some other things to consider if you're just barely getting started with infertility treatment, or considering coming in to talk to a physician about not being able to conceive, there will be the diagnostic tests and evaluations that need to be completed to help figure out why you're not being able to conceive naturally. And these initial tests to assess your fertility and determine the best course of action can contribute to the overall cost. Something else to consider too, this is, the clinic's reputation and their success rates. Clinics with high success rates may cost more, but they could potentially lead to fewer cycles overall needing to be completed, which will affect your costs. And then again, just adding one more thing into a non-medical expense that can influence your costs is infertility treatment does have a strong hold against your mental health. And I know a lot of patients have utilized the ability to have counseling services while they're undergoing infertility treatment to be able to manage their mental health in a better way while they're undergoing this treatment. And as I said, that's another non-medical expense that can add on to your overall costs. All right, so now that we have an understanding of our landscape of fertility treatment and things that can affect that medically and non-medically, one of them that we're going to focus on in particular today is specifically related to insurance. Now, this is my bread and butter. I love working with the insurance for our patients. It's a strange thing, but it speaks to me, and I love being able to advocate for our patients with the insurance. And it brings me a lot of joy to be able to help our patients understand how their benefit can work for them. So we are going to go through a couple of different areas of understanding fertility insurance coverage, specifically to insurance benefits. Many insurance companies offer diagnostic and treatment of underlying conditions of infertility, but maybe fertility treatments like IVF might not be covered, especially in states without a mandate to cover them. The other items that we'll need to discuss, we'll discuss under this insurance benefit is by understanding your benefit, it will allow you to maximize the coverage that you need for your fertility needs. And this insurance benefit discussion will also focus on employer-sponsored benefits and state mandates. Next, we'll also look at all of the services within fertility treatment and talk about what is billable to your insurance and what isn't and why. Some other things are if there's, before you're starting treatment, it is important to ask your insurance provider about specific covered services. If referral is required, kind of get information on the basic eligibility of your coverage, copays and deductibles, and make sure those are all understood before starting treatment, and as well as being able to find any limitations on the benefit. And we'll provide you some tips on how you can call and talk to your insurance company and to be able to navigate through that. And lastly, we'll have a little bit of a small discussion about approaching your employer when it comes to needing to add a fertility benefit to their plan if one doesn't exist. So first big question is, will insurance cover infertility? Now, the biggest thing that you're going to find is employer-sponsored plans are generally where you're going to see employers offer fertility benefits, but the comprehensiveness of the coverage varies significantly. Larger groups tend to have more funds available to offer infertility benefits to its employees. Others elect to use a supplemental plan or a reimbursement program, to like Win Fertility or Progeny or Carrot. Another one that's come up is Maven. And these supplemental fertility insurances often integrate with your existing health plan, but it allows providing coverage for specific fertility procedures and services. Now, coverage, as we said, varies based on what the employer elects to cover within the infertility services. Some may choose to cover basic infertility, like infertility testing and diagnosis, and the lesser treatment of IUIs. At times, employers can be fortunate to have a benefit that extends to comprehensive infertility treatment like IVF and embryo transfers and maybe even egg freezing. And the employers can set a benefit maximum for treatment and medications, like they'll put a dollar amount limitation on the plan or a certain cycle limit that you're allowed to do. Perhaps you're only allowed 3 attempts of in vitro fertilization or egg retrieval. Some have unlimited. It just depends on what the employer elects to cover for them. Let's see, another item to consider when you're selecting a medical benefit sponsored by your employer group is the type of plan. Now, what you understand is the type of plan can be what's known as an HMO or a health maintenance organization, a PPO, which is a preferred provider organization, or a POS, which is a point of service. And all of them are different types of health insurance plans with varying levels of flexibility and costs. HMOs, for example, offer the lowest premiums, but they have the most restrictive network. And they usually require referrals for specialists. And generally, from what we've seen within the city of San Diego, HMO plans don't have any facilities within their network to be able to provide IVF treatment for their members. So it becomes a very complicated web of complexity to be able to figure out how to utilize a benefit from an HMO plan within that HMO network. PPOs offer more flexibility. They allow you to be able to see providers outside the network. It does usually come at a higher cost, but you typically don't require referrals, and you're able to utilize and go to any clinic that you want. So if you have a personal preference of a specific physician that you want to see, you're allowed to be able to go see them. And it allows you to be able to go to the clinics that can provide you the treatment that you need. POS plans are essentially a hybrid. They can be kind of like a PPO and an HMO, but they offer lower premiums than a PPO, but sometimes they don't allow you to go out of that particular area without a referral. So essentially they give you like an in-network benefit, but there's no out-of-network benefit for you to be able to pick and choose who you want to go see as your preferred provider. I would always recommend that in your search for a fertility clinic to verify with that fertility clinic which insurances they're contracted with, and that you can use your selected benefits at their facility and to cover their treatment. For RPSD, our list of contracted insurance companies is provided on our website. I think any reputable clinic will also put those on there for you to be able to find if your insurance is contracted with that particular group that you want to go see. The next thing to consider with your insurance coverage is the insurance carrier. So in addition to selecting the type of health plan, another factor that I recommend all of our patients to consider is the specific insurance company that you're going to choose your benefits to come from. Each insurance company has its own regulations and its own clinical policies, many of which offer a specific infertility benefit management department. And under these clinical policies, or sometimes they're called clinical guidelines, this clinical policy is a document that is used by the insurance companies to guide coverage decisions regarding specific medical services, procedures, and treatment. And they essentially act as like internal policies to help clarify what's considered medically necessary and therefore what's covered by the plan. And these policies are based on evidence from peer-reviewed studies, the consensus statements, and expert opinions. But each company gets to decide what will be the outline of their criteria in their clinical policies, and as such, determining medical necessity. So the clinical policies that each individual insurance company has are used in conjunction with the patient-specific benefit and applied during the prior approval process and the claims process. And so the more restrictions that an insurance company has within these clinical policies, the less likely we are able to have certain services be considered medically necessary. My recommendation for you on which insurance carrier is the right one is to contact your insurance provider even as a potential new member, and ask about the limitations and exclusions under infertility treatment, and try to get details specific to your plan if you're already a member, and if not, what other clinical guidelines they require their members to meet when it comes to infertility benefits. Now, some of that criteria and the specific limitations are not necessarily subject to the clinical policy. There are times where employer-sponsored plans will put limitations and restrictions on specifically their benefit. So at times I have seen a service for a member be denied, and they wanted to appeal it against the insurance, but the unfortunate thing was it wasn't a medical decision. It was an administrative denial, and that meant that the employer had the restrictions on the plan. The guidance we gave that member was to go back to their HR and talk to their human resources department about that restriction and how it actually is affecting them in the real world. The next thing that we are going to discuss is about insurance covering infertility is something that is called state mandates. Now, in the US, there are 22 states and the District of Columbia that have laws mandating some form of fertility treatment coverage, but the specifics vary greatly. While some states mandate coverage for IVF and fertility preservation, others may only mandate coverage for certain treatments or for specific populations of people. And many states have exemptions, such as those exemptions are for small employer groups, religious employers, or self-funded plans. And state mandates do not extend to Medicaid plans, federal plans, or to military plans through TRICARE. Now, specifically in California, since that's where Reproductive Partners Fertility Center San Diego is located, I did want to focus a little bit on the state mandates within the state of California. First, the State Bill 600, this law was passed in 2019, and this mandates that fully insured plans written in California are to cover fertility preservation for iatrogenic treatment, which again, remember, is chemotherapy, radiation, and pelvic surgery as basic healthcare coverage. Now, it's a great starting point, and I know that it is currently undergoing a lot of revision to be able to ensure the best treatment coverage for this pool of patients. The second state mandate is new, and I'm actually very excited that this is coming into play. But current law in California under the mandate is essentially a partial mandate. What that means is the insurers are required to offer fertility benefits as an optional benefit for the employers to purchase when they begin purchasing their annual insurance plans. But beginning on July 1st of 2025, a new Senate Bill 729, will now require that large group, fully insured health plans, that is, employers that cover at least 100 people, provide coverage for the diagnosis and treatment of infertility, as well as a maximum of 3 egg retrievals and unlimited transfers. Now, that is going to be a wonderful opportunity, and it is going to give a lot of opportunity for family building to a lot of our potential patients. And we're very thrilled to be able to be a part of this journey with this mandate. And we are currently working very hard in our administrative tasks and teams to be able to be sure that we can help patients utilize this under the state mandate. Now, if you happen to be watching this webinar and you reside outside of the state of California, to determine specifics of infertility insurance coverage in your particular state, I would actually recommend that you consult with the state-specific information from resources like Resolve, the National Infertility Association, or other reputable sources to be able to determine what mandates exist in your state. All right, so what is billable and what is not billable for infertility services? What you can see here is we have our different fertility treatment options, right? We have our IUI services, we have our IVF and FET services, egg freezing services, and then I've also included different diagnostics as well as other services that are related to ART procedures that can add to your overall costs. Now, the complexity of infertility treatment means there are several different services and procedures involved, and it is best to understand which are billable to the insurance and may be able to help offset the cost of your treatments. Now, as I said, these are the common infertility, these are the common fertility treatments, but this is the list of services that may or may not be necessary during one of those procedures. The one thing that becomes very frustrating when we're working with a lot of patients in understanding their insurance is just because a benefit says it's covered or says it covers IVF, that doesn't necessarily guarantee that each and every one of these services listed under our IVF services are actually going to be billable to the insurance plan. The benefit limitations and the clinical policy restrictions play a major role in the accessibility of coverage. Now, here at RPSD, we have experienced and proficient benefit specialists who complete an insurance verification for every patient scheduled to meet one of our highly skilled physicians at the beginning of their infertility journey. And we give this as a complimentary service as we join our patients on their path to parenthood, because we've come to recognize these benefit verifications contribute to a more accurate cost estimate that is allowing us to be able to tailor it to each patient's needs. And being able to complete these benefit verifications allows us to understand if a prior authorization for services is necessary, and we can work directly with the health plan to be able to determine what these limitations and exceptions are, if there's specific medical criteria that has to be met to be able to utilize this benefit. For example, with that additional service that we mentioned at the beginning that's called ICSI, as part of the insemination process, there's a certain insurance company that does require the male partner to have had 2 abnormal semen analyses before they consider that medically necessary. So at the front end, while we have a benefit verification that comes in and they explain to us that this service or ICSI is considered a covered service, what they are able to tell you is that on the back end during the prior authorization process, it's held up to this clinical policy where these extra restrictions are in place that the patient has to then meet. So while they tell you at the front, yes, this is covered, on the back end, what they're unaware of in the benefit department is all of those criteria that you must meet to be able to actually have that service be billable. So at times we're able to learn that something is considered billable, but after prior authorization is complete, we learn that it's not on behalf of the patient. And we do try our very best to be able to complete that before the patients undergo their treatment. We work really hard to try to prevent any surprise billing that may come at the end of any of these treatments. And we do, and as we said, we provide this cost estimate to patients to be able to help gain a greater understanding of what is expected of them and their finances as they move through. Now, as I said, this is a lot of what our skilled benefit specialists and administrative team are able to offer at Reproductive Partners. However, we do understand that there are times that we are unable to help patients speaking to their insurance company. There's times that patients have to call and complete services or answer questions on their own as the member because they will not provide that information to us as your provider. So when that happens, we just wanted to be sure that you're aware and have some navigational tips when talking to the insurance. And I'm going to give those to you because that's what I've been doing with Reproductive Partners for 14 years. So if your infertility clinic does not have a benefit specialist, or like I said, there's questions that you have or items that only you can manage with your insurance, what do we do? How do I do this? Here I have some navigational tips for you to be able to prepare yourself and when you're calling your insurance company. The best thing to remember is that we always want to, be professional, remain calm and polite and respectful. And if you can do that, you'll be able to have a much better conversation with the benefit specialist and they'll be more receptive to you. The key thing too, document everything. Document everything. Keep detailed records of all your calls, any email correspondence that you have back and forth, and any other communication between you and your insurance group. Collect names of agents that you talk to, as well as reference numbers for any point of contact that you have. If there's ever a discrepancy in what they've told you at the beginning, say on a benefit line at the front, and then it comes to a claims process, and it's not being covered the way that it was explained to you at the benefits, you have all of those details documented to back it up and to be able to push back against that claim. Now, in my experience, I know that infertility can be a very emotional journey. And so when things don't go your way, or you're having a very difficult time trying to get the agent to understand you, don't be overly reactive. Avoid venting your emotions or being overly emotional, because honestly, that intake agent has no power to make any changes for you. They're essentially going to be the messenger. They're going to receive your request and take it to the next person to be able to execute it. The other thing that you can recommend in addition to that of avoiding this emotional venting is to focus on the facts. Be very present and clearly state your case and be concise. And use objective information to support your claim against what they've told you. The other thing is, don't be afraid to ask questions. The benefit agents are there to answer your questions. It is literally their job. So don't be afraid to clarify any unclear points or ask to seek for further information if it's needed to get a better understanding of your benefit. And along the lines with that, don't feel rushed. Don't feel like you have to push through this quickly, and don't let them push you off the line. Take your time to be able to understand the process and the implications of your decisions as you're going through and speaking with these insurance agents. My experience has also shown that with insurance, we have to take a more proactive approach. So don't wait for the insurance company to reach out to you. Initiate the contact and follow up with them. And if they say, it's going to take us about 30 days to be able to get this audit for your infertility benefit, put that on your calendar and call them back in 30 days and hold them to it. Hold them to that promise. The last thing that I can advise our members and patients is to not be afraid to ask for help from your employer's HR department. A lot of them can give you the ability to work with a patient healthcare advocate, and they are a very knowledgeable group of people, and they really do have this ability to work directly with the healthcare provider that your employer group has selected and help you navigate your way through any troubles that you might be having as you go on for that. Okay, so what if you're listening to this and you realize, okay, that's nice and all, but my employer does not have an infertility benefit. What can I do? There are some things you can do. If your employer currently does not offer infertility coverage, we're going to look at trying a couple of things to be able to help you do that. The first thing is you will want to try to understand your employer's situation instead of trying to just, come in guns blazing saying you need to cover things with infertility. Try to seek to understand where your employer is coming from and understand their situation. As we covered with the state mandate, they have to have employee groups of over 100 people to be able to fall under that mandate. So check your employee count. If your employer has fewer than 50 full-time employees, they're not even obligated to offer health insurance, let alone infertility coverage. So check the employee count. Be sure that when you go to talk to them about it, that you understand your current coverage. If they do offer coverage, be sure that you understand its features and your eligibility. Read your benefit booklet and the summary plan description. And then if it's still not clear for you, ask for help with clarification from your HR department if necessary. Now, the other thing to remember is if you're working to try to make this change, you have to remember that changes take time. And your major coverage changes like this can take months to work into a current benefit sponsored by an employer. So be aware of the open enrollment period when you're allowed to make coverages for selection, that it's going to take some time, many months before that open enrollment, to be able to have those new options available. The last thing is, double check if there's any legal requirements. Like you said, research the employer is responsible for any state mandates and that they may not be aware of, and you can bring that to their attention. So once you've made yourself aware of your employer's situation, start advocating for change. Talk to your HR. Discuss your concerns with them, including the benefits of offering fertility coverage to employees. A great way to do that is to research and present options, gather the information about different plans and explore options like those supplemental coverages that can allow that. And don't be afraid to highlight the benefits of how an employer-sponsored fertility benefit can attract and retain talent, and it can improve employee morale, and essentially it will eventually reduce the costs associated with employee health issues. If there's many of the employees that feel the same way as you do, consider creating a petition or organizing a group to advocate for better coverage. You can discuss and negotiate if you're working with a new employer looking to come in as a job opportunity. You can discuss employer-sponsored fertility benefit options then. And lastly, this exploring alternative options. There's a story I wanted to share with you, is that you can find other employers with a benefit that offers coverage for infertility. You may or may not have seen it in several years back, but there was a woman that took a part-time job with a coffee company that offered an infertility benefit. And she took a part-time job enough to be able to collect insurance benefits. And she had stated that essentially her entire paycheck went to cover her insurance premium. But that insurance premium allowed her to be able to receive infertility treatment at a much lower cost. The other thing to consider is if you are going through infertility with a partner and the partner's plan offers infertility, consider adding yourself to their plan during the open enrollment and utilize the benefit that way, if time allows for you to be able to do that. As we wrap up our portion about infertility, the one thing I do want to caution and remind all of you is that remember, when you're selecting an insurance plan, that infertility is only a small portion of what you should consider for your medical benefit coverage. Be sure that when you're selecting medical benefits, that you select the plan that cares for all of your medical needs and not just focusing on the infertility portion of it. All right, so lastly, we're going to discuss a little bit about some payment options and financial assistance. So if insurance is not going to be able to help with the cost of fertility treatment, there are other options to be able to make available for you when working to create your family. We will briefly discuss some financing options, different grant opportunities, as well as financial programs and scholarships. And then we will conclude by talking specifically about how RPSD provides financial support to its patients. So before deciding whether or not treatment costs make it too expensive to have a baby, make sure you've explored all of your options. There are several financial resources you can turn to as you go through the experience of building your family. They vary with their focus, but some assist with medication costs or specific treatments like in vitro fertilization. Others cover a much broader area, can cover both. The first type of financial resource that you can utilize is specifically a fertility loan. And these are personal loans specifically designed to cover the expenses of fertility treatments like IUI, IVF, egg freezing, and more. They're often unsecured and can help spread the cost of treatment over time. RPSD patients partner specifically with CapEx MD and Lending Club for financing options here. CapEx MD specializes in patient financing services for all fertility treatment options. They have a really easy loan process with competitive rates and a variety of loan types, including financing for fertility medications. And this ensures that the financial aspects of treatment are not an obstacle for you in achieving your dream of a family. And once you're approved, their fertility loan specialists work very closely with Reproductive Partners to ensure everything is in place when you begin your treatment. Now, the other group, if you like to play around with numbers as you decide how much of your fertility treatment costs you can afford on your own, what insurance covers, and then how much you may want to finance, Lending Club Patient Solutions has a free fertility payment calculator that you can use. And with the Lending Club Patient Solutions calculator, you can run different scenarios. You can look at the loan amounts and payment terms to determine what is going to work best for you and for your budget. But the bottom line is research different options, explore various clinics, financing companies, and compare their terms and conditions. Another source of financing that has become more popular in recent years is actually crowdfunding. More couples have turned to crowdfunding. They publicize their struggles, inviting empathy, but it also, is risking emotional vulnerability and judgment. But some people might find crowdfunding unsettling, but others see it as a lifeline and a symbol of collective hope, with their family and friends and a community. So crowdfunding in many cases does become a final option for these people to ask family and friends and even strangers to help them close the gap between what's a dream and what can potentially be reality. Now, through these campaigns, through crowdfunding, the generosity of the community becomes a more powerful force and allowing people to face the financial burdens of fertility treatment with renewed strength. I have fought for several years to make sure that patients that are undergoing infertility are not fighting in silence, that they're not alone anymore. When I first went through infertility treatment, that's how I felt. It was a silent disease and nobody talked about it and nobody wanted to talk about it. And it was very isolating. And I like this idea of reaching out to your community and being able to have that become a powerful force working together. So I'm grateful that there's people that have considered crowdfunding and are utilizing that as an option and not afraid to share their journey to help others along the way. A few other saving strategies for you is honestly, bottom line, create a budget. Create a realistic budget and determine how much you can afford to pay each month. and start setting money aside. You know, the best time to save money is when you have money. The other thing is don't hesitate to ask when you're working to try to find ways for funding, to ask about discounts, payment plans, or other financing options from different providers. And that includes pharmacies. Talk to different pharmacies about the cost of the medications. Personally, I did that as well. I called several different pharmacies asking what each medication that was a part of my treatment protocol costs out of pocket. And I just did it. I went to each individual pharmacy that I could, and I picked up the least expensive medication possible. So don't forget to ask those questions, because it's only going to benefit you if you do. The last part, don't be afraid to seek for guidance. This is a big undertaking, and it's not something that is taught in everyday living. So talk to your fertility clinic or even to a financial advisor to get personal advice on navigating fertility financing options. One of these options that we've discussed, though, that we'll move on to is there are other opportunities out there like grants and financial assistance programs with scholarships. These fertility financial assistance programs can help offset the high costs of infertility treatment. Options, like we said, include grants, loans, and sometimes even discounts. Grants, for example, from a couple of these organizations like Baby Quest Foundation and Hope for Fertility can cover a portion of the costs. So here's a couple. We'll go into a little bit more of a detailed look about these various different grant options. Now, grants have a specific criteria that you must meet in order to receive them. Many grants are state specific in that you are required to either work and or reside in that particular state, and they may be a requirement to be used at a specific clinic. Many grants have an application fee as well, so it's important for you to understand the grant requirements and specifically where and how grant funds may be used before you submit your application. Baby Quest Foundation, for example, they offer grants to cover a wide range of fertility treatments, including IVF and egg freezing and even surrogacy and medications. And Baby Quest awards these grants twice a year. Hope for Fertility, they can provide grants that can be used towards clinic costs and adoption-related expenses. The other group here in the middle that you see is Footsteps for Fertility. Now, this fertility grant are awarded to couples who require fertility treatments to have kids, and it's done as an in-kind donation, either from a SART recognized clinical partner or in a monetary donation. Now, all of these grants are awarded via random selection, directly at an award event. With each event registration, participants will receive one complimentary ticket to enter the random selection process on behalf of the applicant they're supporting. So that's another foundation that uses that. The CADE Foundation offers family building grants up to $10,000 per family to help with fertility treatment or domestic adoption costs. We've already talked a lot about the fertility loans, and that's a lot of what CapXMD does. But they are specialized loans for fertility treatments that offer various financial institutions. And other resources that you can look at outside of this webinar for financing programs and scholarships and grants are going to be able to be found on the Resolve website, the National Infertility Association. Lastly, was with grants and financial assistance programs. Some other tips for finding those assistance is, explore, research different grant programs and loan options that finds the best fit for you. Nobody's journey is the same. Just because it worked for a friend of yours doesn't mean that's what's going to work for you. As you're getting ready to go through these application programs, as we said, gather all the necessary documentation that you need, like financial statements. You may need medical records when applying for grants and loans. So make sure that you have all of those available. And also, lastly, consult with your fertility clinic. A lot of them can provide guidance and resources for financial assistance. Just like at RPSD, we have dedicated financial counselors, and they play a crucial role in helping our patients understand and manage the financial aspects of their healthcare services. They work with patients, insurance companies, nurses, and the providers to ensure accurate billing, payment processing, and financial assistance options that are catered to each of our patients' needs. Along with that, our financial counselors provide this guidance, support, and resources to our patients and their families, helping them to navigate complex insurance policies, billing procedures, and any other financial obligations that may arise. And as you come into Reproductive Partners Fertility Center San Diego, you're always going to have a financial counselor to assist you. I personally, as the insurance administrator, work directly and hand in hand with our financial counselors to be sure that the insurance portion of their support to you is accurate as possible and is understood as possible. And not only that, to be able to advocate for you on your behalf to the insurance company to help, as we said, maximize your coverage through the insurance. And with that, today, that concludes my presentation to you. If there are any questions that came up during the presentation, you are welcome to post them on the Q&A session online. Anytime that you have questions, if you're a current patient of Reproductive Partners, you are welcome to be able to call and ask these questions to either myself or any one of our administrative team and our financial counselors. We're more than happy to help you out as best as possible. And with that, if there are any other questions, I'm sure you'll think of some as they come along, but we'd be happy to help you anytime then. But I just wanted to thank you for coming and participating in this webinar. It has been a delightful experience to be able to provide this information to you to help you have a more knowledgeable journey with your finances in infertility. And again, if you need to reach us, we're available on the web with our website at www.fertilityclinicsandiego.com. You can call us directly, and we'll look forward to seeing you next time. So thank you all for coming. I appreciate that, and I hope you have a wonderful day.